Another new week brings forth another new episode of Fearless, and today it is going to be quite a heavy one, and I want you to be prepared because we have a very, very special lady who's going to be taking us through mental health. I think for the longest time, especially in the recent years, we've seen so many conversations about mental health, but really, do we understand what mental health is about? Do you understand even as you sit there watching me? So that is what we are going to try and tackle today, and also just bring and shed more light into this conversation, because also seeing all the cases in 2020 pop up on, suicides, many other things, it is quite a worrying trend, and I feel like this is a very relevant topic to have right now. So without further ado, we have Dr. Vundi helping us understand more about mental health. But before you meet this gorgeous secretary, we make sure to use the hashtag stay fearless, be fearless, hashtag fearless, because this is what it is all about. My name is Tracy Wanjiru, and welcome. We are at Tomoka Coffee House, which is an Ethiopian coffee house here in the heart of Westlands. Make sure to drop by. I just tried their sandwich. I don't know which one it was, but it was amazing. Other than that, I love the ambience. I love the fact that you can come here, have a meeting, and there's not too much happening. I also love the fact that you can come here and just sit down and work or read a book, and it's quite conducive for all of that. And also they have amazing food, amazing coffee. Of course, it is Ethiopian coffee, one of the best coffee in the world. Without further ado, let's now get to meet Dr. Vundi.
Hi guys, I'm Dr. Vundi, and I'm so happy to be here. I'm so happy to be on the Fearless platform. I'm a medical doctor who's specializing in psychiatry, so mental health is my passion. And because of that, I have a YouTube channel and where I kind of talk about wellness and mental health.
You can already tell that we are in good hands. Again, welcome, Dr. Vundi. For many people, right, and I think for so many, for the past recent years, right, we've seen so many people vocalize about mental health, but do people really understand what mental health is?
I think people have an understanding of it, but the full scope of it, no. People don't understand how bad things can get. People don't understand how to take care of their mental health. And they also don't understand where to go when they have a problem with their mental health. So they don't have a full, complete understanding of the same.
Right.
Yeah.
But also, I feel like you also can really get a full understanding about mental health, because I can imagine there's so many things that influence why, someone would have, different issues in regards to mental health, right?
Yeah, you can't fully grasp the whole of it. And so what we kind of push, and the message I'm always pushing, is to constantly keep working on your mental health. So it's the effort that counts. It's constantly researching, looking into all the resources that are out there, being informed about your mental health, being proactive when it comes to your mental health.
Right. So if we were just to simplify what mental health is, right? How would we simplify it? Because now we've seen so many things crop up to a point you're even confused. You're like, okay, am I really going through a mental health crisis, or am I it's just life?
It's life, yeah.
Or, so what is mental health and what is not mental health?
Okay, so mental health is everything that has to do with your thoughts, your feelings, and your behaviors. Okay, so that's a way of really simplifying it. And let me start off with your thoughts. So it encompasses what you think most of the time. Because, Tracy, sometimes you have good thoughts and sometimes you have bad thoughts, yeah? But the point is, what's the average? Yeah, are you always thinking negative thoughts? Are you always thinking thoughts of low self-worth? Is that your average? So that's how you kind of track your thoughts. And when we're talking about your feelings, it's also your predominant feeling. How do you feel most of the day, every other day? Yeah, because the times you're happy, the times something happens and you're sad, the times you have a good week and a bad week.
Right.
But when you look at yourself for about 6 months to a year,
what has been the most consistent?
Absolutely.
Feeling,
so
right?
That's how you gauge your feelings. And then mental health also looks at your behaviors. And this one talks about little things such as anger outbursts, acts of violence, aggression, all that has to do with mental health. Even issues such as addiction, gambling, those kind of behaviors all contribute to your mental health. So if you want to know how your mental health is doing, think about how are my thoughts, how are my feelings, and how are my behaviors.
Right. So how much understanding is too much understanding?
It's a personal decision. So boundaries are personal. There are universal boundaries, but there are personal boundaries, and it's up to you as a person to decide how much is too much for you. So if it crosses your boundary, you say something about it.
Right. I think also one of the things that comes with mental health, you know, or people who are affected by mental health, it doesn't have to be directly, like they're the ones suffering, but indirectly, you know, like the receivers of, for example, it could be abuse, right? How are they able to communicate well with the people who, you know, because you feel bad for them. You're like, you know what, but, you know, they're going through a depressing state. So how do I really communicate that their depression is affecting me?
Yeah, without looking selfish.
Exactly.
I understand. Sometimes it's not, I mean, you can try and just communicate openly and say, you know, this is making me feel some type of way. But sometimes it's not always about telling the person how you feel. Sometimes it's also taking your space back. Because let's say you're my friend and you have a mental health issue and it's weighing me down, right? Sometimes our approach as human beings is for me to come and tell you, you know, this thing is like, it's affecting me so much, but sometimes that's not really the solution. Sometimes it's to support and to love from afar. And that's something that people feel so guilty about doing that, and I don't understand why. It's okay to get space from somebody if they are like weighing you down. It's totally okay. And when somebody is struggling with a mental health issue, we need to stop trying to be their savior. You know, a lot of people have this savior complex, like I want to save you, I want to help you. And that's why we end up being exhausted at the end of the day. It's not your job to help them. It's really not. Your job is to be their friend, and it's okay to take breaks if you're exhausted. Leave the mental health issue to the professionals like us. Yeah, if it's exhausting you, take a break.
Right, and you don't have to explain it.
You don't have to over-explain it. I mean, of course, it's always nice to communicate how you feel, but you don't have to feel guilty, kind of like explain yourself. No, you don't have to.
Right.
You don't have to.
So now, the past year, especially 2020, once we all got into quarantine and, you know, the curfews and all that, like, it's like life shifted, right? It's like it went from, how many things do we really know that happen in this world, right? And, you know, the cases of suicide, right? The cases of people killing each other. Like, even, you know, I remember just sitting down the other day and thinking, were we just, like...
It's a lot.
Like,
it's a lot.
Yeah, are we just evil? You know what I mean?
Yeah,
because you really get to wonder, because all these cases, and it's all suicide, death. Yesterday I saw a video of a child who burned his entire village, right, to the ground and ran away. So, you know, you look at all these things and you wonder, is it that the times have made us more predispositioned to mental health issues? Are those mental health issues in the first place?
Absolutely. I think the environment always contributes and shapes people, and it contributes to mental health issues. And I feel like sometimes it takes just one thing, yeah? Anger builds up over time, anger and rage and frustration. And I think that's what's been happening in the country. People have been getting progressively angry, progressively stressed out. You can tell even how people are driving on the roads, like everybody is just on edge. And then it takes just one thing to disrupt our everyday. And then you start seeing a rise in the cases of all this sociopathic kind of behavior, because honestly, those are sociopaths and psychopaths who do such things. And so I don't think we're evil, but I feel like what we haven't done as a country is we've not been paying attention to people's mental health. We don't pay attention to it. So it kind of builds up and builds up and builds up and builds up. And then one thing happens and then it's a whole mess.
Right.
It's a whole mess. The culture out there in the West is that seeing a therapist is so normal. Like, people will be speaking in conversation and they'll say something like, oh yeah, after this I'm going to meet my therapist, and that's normal. Here in Kenya, you tell somebody that you're going to see a psychiatrist, there is so much judgment. Guys will start labeling you, she's crazy. Yeah. You know what I mean? Like those kind of words. And the fact that we've not been paying attention to our mental health as a country, we'll end up paying for it. And I don't think this is even the worst. I'm thinking it could even get worse. It could even get worse.
Also, we talked about therapists and seeking help, but one of the things that we've realized in Kenya, seeking help, especially you know, the help of therapists, it's so expensive.
It's expensive, yeah.
It's because you have a sit down for probably 1 hour and it's 5,000 Kenya shillings. How many people can actually afford 5,000 shillings for just 1 hour? And to be honest, sometimes 1 hour to talk about your problems is not enough.
Yeah,
like, you want to keep going on and on and on and on. So what do you think there's a way that mental health, you know, institutions can reduce their prices, or do we even have institutions where they probably give it free of charge?
There are, well, the thing is, there are some institutions that are very affordable, but Kenyans have stigmatized them. And I'll start with Mathare Hospital, which is where I do my training. And we do have therapists who are there, and it costs 500 shillings, yeah, to open a file and to get a therapist to talk to you. But you see, the thing is, people are like, I would never go to Mathare, you understand? We also have the Department of Mental Health in Kenyatta, about the same amount, 500 shillings, you get to talk to a therapist, but people don't want to go to Kenyatta. So, I mean, unfortunately in Kenya, our healthcare system is split. We have the private healthcare, which is so expensive, the 5,000 you were mentioning, and then we have the public institutions, which are affordable, but they're not that good.
People are skeptical about going there. And
the thing is, we don't fight for our healthcare system to reform, and so we are suffering. You understand? And so, I mean, I get it. We sit and we complain, you know, mental health access and the services are so expensive. But you guys, you don't rally behind us as doctors when we start fighting for these things, when we start fighting for our healthcare system, because we don't always go there to fight for more pay. Sometimes we're like, look, we don't have the medication we need. Sometimes, Tracy, I'll be in Mathare and I'll prescribe something and it's not available, and it really breaks my heart, but what do we do? So I think my message to us all is, let's start fighting for a better healthcare system, because if our public healthcare system was top-notch, we wouldn't have to pay 5,000 shillings to talk to a therapist.
Exactly. Yeah. And you know, they always say that the smallest unit of the society is the family, right? And looking at the family, because most of these people who are doing these things, I mean, it's so shocking, but most of them are children, right? I mean, every other day, there's at least a headline about a child who's done something. And it's not like back in the day where a child would, the worst thing that they would do is insult a teacher. You know, now they're doing the most, right? So, you know, I also look back and wonder, me as, for example, a mother, me as a father, how am I able to tell, you know what, my daughter Vundi is going through something, right? Because there's so many things happening, and at the same time, you're also not a doctor. You know, you might just think, you know what, this child is just being naughty, just does not want to listen. But how are you able to really see these things from the small beginnings? Because to the time we start talking about a country, it has to have started somewhere.
How can a parent know that your child is, that a child is struggling in terms of their mental health, be it depression, or anxiety, suicidal thoughts? The first thing is a change of their behavior. Just let's always remember the first thing that I said, thoughts, feelings, and behaviors, right? So if your child's behavior has changed in one way or another, let's say your child used to do certain things, your child used to be very talkative, and now they can't even speak, like you ask them to pray before the meal and they're just like, they can't. Any change of behavior, that should tell you something. Behavior can even mean the kind of crowd they're hanging out with. So they used to hang out with some certain people, and then now they're hanging out with people who you look at them and you're like,
there's something,
you know. So behavior, and then also thoughts and feelings. And the only way to know what your child is thinking and feeling is if you talk to them. And I think we're in a society where parents are not talking to their kids. And I'm not accusing anybody, I'm just saying what I see, because I get to see a lot of youth and children coming to us. We don't talk to our kids, we don't talk to them, we don't ask them, what did you do today, how are you feeling? We don't know that our kids are being bullied in school. We don't know, kids are getting raped and they're not saying, they can't tell their parents. So talk to your kids, they will always open up to you. Something else you can do as a parent is to kind of ask yourself, what could you have done to contribute to your child having mental health issues? Because sometimes it's you, sometimes you're the problem. And I'm always, this is something I say very frequently. I've been saying, don't become the reason that your child needs therapy one day. Don't become the reason that your child will come to us and say, you know what, my mom, ABCD. So introspect, ask yourself, look into yourself and ask, are you really a present parent? Kids are watching you. They're watching you, they're watching your marriage, they're watching every single thing that you do. So start with you. Right.
I think that's so important, because one of the things that we've seen parents, even when all these cases came out, and you know, of course, the media are like, yeah. What do you want to say? You know, they're like, yeah. Oh, watoto, yeah. You know what I mean, serikali or something, you know. But then parents are not really looking at what about them might make a child act the way they are, because during that 2020 period, who were the children with the most? It is the parents, right? So
absolutely,
yeah.
And Tracy, I'm going to share with you a story. Of course, I got the consent of the person to share this story. I went to a very rural part of Kenya recently, just to do some kind of research, and I met this young girl, and from a very young age, her father used to abuse her. From a very, very young age, her biological father. And so I spoke to her, and that was that. And then I also spoke to her mom. And as I was speaking to the mom, I kind of like was asking her, you know, how do you feel about this? Because she knows. And you won't believe it, but she was saying that it's her daughter's fault that she got raped by her dad. And I couldn't believe it. I kept asking her, like,
why do you think it's...
I kept asking her, what if somebody raped you today? Would it be your fault? And she said, no, it would not be my fault. Then I would repeat the question, but she's been raped. Is it her fault? She'd say yes. So it's sometimes we're in so much denial. We're in so much denial, and that story broke me, because I couldn't believe it. And this is her own daughter. This is her own daughter.
Wow.
Yeah.
Thank you so much for watching this episode. We appreciate the love, we appreciate the support. And more than that, I think our main goal here is just to impact people's lives, right? So thank you again for watching Fearless. Thank you, Dr. Vundi. Thank you, Tomoka Coffee House, for having us. They're located at Two Rivers Mall. There's also where we are right now is in Westlands. Just Koyo roundabout Yasarid Center, just there. You will see it. Yeah. Thank you guys. So see you guys next week.
Bye.